Assalamualaikum and a very good morning to Dr. Norhiza and fellow classmates. My name is Sona Rauda, and together with my partner, Fania Afina, we are pleased to present our parent report entitled How Robotic Technologies Can Assist Healthcare Providers and Improve Manufacturing. As we all may know, modern healthcare faces increasing challenges such as staff shortages, slow training, and limited access to expert care. These issues reduce treatment quality, delay services, and place pressure on medical workers. For students, traditional learning methods require physical presence, real life patients, and also supervision, which are not only costly, risky, but also time consuming. For example, many students rely on rare opportunities to observe live surgeries. Without proper tools, they miss chances to practice key skills. Therefore, technologies like augmented reality, virtual reality, robotic surgery, and also telesurgery are becoming essential in improving healthcare and training by offering safe and modern solutions. This report examines how robotic technologies can improve healthcare delivery and medical training by addressing staff shortages and also educational limitations. The healthcare system continues to struggle with the lack of trained staff and limited access to advanced medical tools. These problems affect both patient care and medical education negatively. When hospitals lack resources, services become slower and less effective. For example, a clinic without enough doctors or modern machines may not provide timely treatment or proper student guidance. As a result, both patient outcomes and student learning process are compromised. One major cause is the shortage of medical professionals such as doctors, nurses, and also specialists. This causes hospitals to become overloaded and reduces training opportunities. Students also face limits because live patients and expert supervisions are not always available or reliable. For instance, in rural hospitals, students may only observe a few surgeries due to fewer staff and also fewer cases. These limits make training inconsistent, therefore creates the unequal gaps between students in different areas. To the lack of exposure of modern tools like robotics, AR, and VR. The effects can be seen in both patient care and also education. Staff shortages reduce personal attention, especially for vulnerable groups like dementia patients and also children who may feel isolated. For example, overworked nurses may not have time to talk to or calm these patients, leading to loneliness and agitation. However, in education, students who are not trained with modern tools may struggle to use them in real life practice. As a result, hospitals may be slow to adopt to these innovations, and the overall system become less efficient. I will pass this stage to my friend Fadli Dafina to explain the possible solution to these problems.
Hello everyone, my name is Failin Afina binti Daud, and today I will be explaining for proposed solutions part and also the conclusions. So let's dive into it. First of all, we have the implement blended learning approach in the classroom. So in this part, we have 3 points, which is we have AI and VR, and also we have robotical surgical system, and last we have telesurgery. Okay, let's go with the first point, which is AI and VR. So what is AR? AR is augmented reality, which is it can show the 3D anatomical overlay during the medical procedure, while VR is a virtual reality where it gives students a chance to practice safely through simulations without using the real patients. So next we have robotical surgical system such as the Da Vinci and also Medtronic that can be used in virtual training platform. So this actually helps students to get familiar with how the system works, and also they are better prepared when they enter the real operations room. Okay, so last we have the tele surgery, which is use network and robotics for remote operations. So they can be shown through blended learning as model of remote treatment. Okay, so let's go to the next proposed solutions. All right, moving on to the next proposed solutions, which is using Pero robot for dementia patient care. So as you can see here, Pero is actually a robotic cells that respond to touch and sounds. So it's basically behave like a pet and also used to provide comfort and emotional support for especially elderly dementia patients. So these are usually used in a place where staff are very limited and too busy to provide constant attentions. So interacting with Peru actually shown to reduce anxiety and also improve the mood of the patient. So this actually create a more positive and calm care environment. However, we also recognize that there are ethical concern because some people are worried that using robot it may replace real human interactions. So that's why Pero should use only for support but not for replace human care. So with a clear guidelines and also staff training, Paro can be safely and effectively integrate into dementia care. So yeah, let's move on to conclusion. All right, so in conclusion, we believe that the advanced technologies like blended learning, robotic surgery tools, telesurgery, and also the therapeutic robots like Pero actually offers a practical solution to some of the biggest challenges in healthcare. So by carefully and responsibly integrate these tools, we actually can improve medical educations, patient care, and overall healthcare delivery. So these tools actually do not replace healthcare, but instead they actually support them in delivering more efficient and compassionate care. So yes, that's all from us. I would say thank you for listening to our presentation and see you next time.